Well, let's begin with the lecture on lecture number 16. Excuse me, the slideshow on lecture number 16. And we will push to complete this discussion of the pharyngeal apparatus and start on lecture 17 if possible. If not, we'll continue on and try to crunch things and catch up as we proceed through the week. So without any further ado, I will go to the slideshow. So the first thing to note is the spelling is pharynx, and the adult structure, the pharynx, obviously is going to be developed from this. I emphasize this because it is still relatively common for individuals to mispronounce this as pharynx and larynx, and we want to emphasize that the Y comes before the N, so it is pharyngeal apparatus. We begin with an overview and layer on the details as we proceed. So this is obviously the development of the regions of the head and the neck, and we will begin to see it in the fourth week embryo. There are four parts to this developing area, and the structures related to it are the arches. There will be pouches on the inside in between them. There will be grooves, and there will be membranes. So these will be terms that we will watch for as we proceed. We have all heard the terminology that ontogeny recapitulates phylogeny, meaning that the embryonic development reproduces, basically, if you want to think of it that way, or recreates along the way structures that are similar throughout the phyla. So ontogeny recapitulates phylogeny, and we will see how this lower head and neck area looks very much like the gills of the fish and amphibians, and thereby it gets this Latin name branchial. So another term for these arches is branchial arches, or we very likely will continue to use the term pharyngeal arches. Branchial, as we just stated, originates from that basic tenet that ontogeny recapitulates phylogeny. So here within the end of the third week, we see a lateral view of the human embryo, and we first recognize the head fold, the forebrain region from the neural tube at this area, obviously becoming dilated with bulges in it or vesicles. We follow that along, orient ourselves to dorsal, yolk stalk, the umbilical cord down here, or body stalk, being on the ventral surface. So the heart is already in the ventral aspect. It started in front of the prochordal plate and moved around in. So the prochordal plate is inside the stomadeum here. So we need to reorient ourselves each time we look at one of these images. You see that there are 1, 2, 3, 4 arches that are present at this stage, and we will soon discover that there is a vascular, actually a neurovascular bundle. Let's just go for it straight out. Contained within each of these, we said that neurovascular bundles, or more specifically listing them as those that have the greatest impact, vasculoneural bundles will dictate the shape of many structures, as they do with these developing structures here. So we will follow the development of those visceral, or branchial, or pharyngeal arches as we proceed. So now we are looking at the lateral view of a human embryo, the end of week 4, so about a week later. These areas become much more complex. There's a tremendous amount of folding and molding that's occurring, forming the pouches and a variety of other things. We see that the eye and the nose are beginning to develop in this area. The ear will begin to develop in this area back here as well. We still can identify 1, 2, 3, and a fourth fold down here. And now we see other terms coming into the picture, a maxillary, mandibular, and hyoid. So there's a variety of structures coming into play to begin the primordial construction of the face and the neck and the related structures. We orient to other things as well. The surface anatomy, the heart bulge, the liver bulge just inferior to it. And then here, placed more dorsally, the forelimb and the hind limb. These are the limb buds. So we're keeping our orientation as we proceed. The umbilical cord exiting the ventral surface of the embryo to become continuous with the chorion of the placenta here. So jump another week, end of week 5, 31 to 34 days, and we see even a more complex development of these structures, the eye becoming more developed. There's something that is happening in the face region, so these structures are coming around and starting to meet each other in the anterior surface of the face. In the neck region, we know that they're going to fuse in the midline, and we have to create the nasal cavity and the nasal openings, the oral cavity, the oral openings, and close off everything else completely to form the pharynx and the larynx on down into the structures within the thorax that are derived from the foregut. Also, as I said, the ear is going to develop from this region and the related structures. So we'll see there's a contribution to all of the structures of the ear that come from these arches, pouches, and membranes. Again, orienting to the heart bulge, we notice that the upper extremity or the forelimb limb bud is now having its separation into a couple of parts. We see the digits forming on the pad, and it's just a foot pad for the hind limb bud. And this reminds us that there's a much more rapid and advanced development of the rostral end than the caudal end of the embryo and fetus and neonate ultimately. So a tremendous amount of activity ongoing in the cranial region of the embryo. Still, from the lateral view, these are basically mirror images of nearly the exact same stage of development, 41 to 42 days. So this is the end of week 6. So we've jumped all the way from week 3 right out to week 6. So there's a very rapid development of these structures. We see the forebrain developed in this area, and then the somites would be in this area back here. They aren't so prominent on the surface anymore. We have the digits appearing in forelimb and hind limb, so a very advanced stage. We're just basically, since we're at the end of week 6, we're a week or so away from the beginning of the 8th week, the fetal period. So we have to complete the development of these key critical structures, especially the face and the neck region, the entire head and neck region. So we see the auricle, the external ear developing here. So from the arches in this area, structures will have contributed to the outer and the middle and the inner ear components. So we'll follow that. We know that the cheekbones, the maxilla and the chin bone, basically the lower jaw, upper jaw, and lower jaw, have to develop in this area. So they're coming together to fuse in the midline. We know that there's a hard palate in the roof of the oral cavity, separates the nasal cavity from the oral cavity. We know that there can be incomplete fusions of these arches, so that there can be cleft lip, cleft palate, and so on and so forth. So we're well aware of facial abnormalities from incomplete development of these structures. So it reminds us that these are arches that are coming together to fuse in the anterior midline, and it is not just at the surface to create the skin and the midline connective tissue. It's everything all the way back to the back of the pharynx. So it is quite a complex sequence of developmental events, and we're not striving to become the experts on this. We're just going to try to pick out some key, unique points about it and try to develop our knowledge in that area for now, so we understand what of the 3 germ cell layers contribute to the formation of these and what they actually end up developing into as the final, let's just say, adult structures, since we think of it that way. And week 7 shown here, we see that the eye is very well developed. The ear has not continued its migration all the way dorsally, and of course the face region is going to be nearly complete. We see the vessels within the umbilical cord present here. Not much yolk sac anymore, so we're just shy of becoming a fetus at this point. So now let's back up to a figure from the textbook, figure 10.2 from the textbook. It's showing the 4.5-week embryo, and we can begin to identify from this lateral view surface structures that we need to draw to our attention. First, we see the nasal placode at the very tip of the rostral or head fold. We recall that this grew very rapidly and folded in. There's also lateral folds, and these arches are what I will include in this lateral folding as well, things going out and coming around toward the front. As the head fold was developed, we recall, as the heart bulge reminds us, that the heart was originally way out in front of the head region and was pulled ventrally, caudally, and then into a position anterior to the chest wall. And that reminds us that the cardiac region was separated from the forebrain region by the prochordal plate. We said that from the very beginning that we recognized the prochordal plate as creating a polarity, a head and tail for the embryo, the embryonic disc. That prochordal plate told us where ultimately the opening to the oral cavity would be developed. So that prochordal plate is now pulled into this area, and the cells have basically become incorporated into a membrane covering the opening into the oral cavity, the primordial opening called the stomadeum. A little more complex than that, but we're just trying to remind ourselves how the head folding and the lateral foldings are very important for creating the face and the neck regions. You see another structure nearby, the optic vesicle, so there's a bulging in this area, so the nose and the eye are going to develop in this area here, not from the pharyngeal arches, but they are points of orientation for us for nearby events that contribute overall to this formation of the face and the neck region. And we begin with the maxillary prominence, the mandibular prominence, the second pharyngeal or hyoid arch, the third pharyngeal arch, and then the fourth arch is very small. So we're seeing that the maxillary prominence is not actually included as one of the arches. It starts with the mandibular prominence as one, the second or hyoid arch shown here, the third pharyngeal arch, and then the fourth pharyngeal arch. There are separate events that are occurring and contributing to the formation of the face and of the head, and the other neck regions will develop from the arches. So, what triggers all of this in the first place? What triggers this lateral, anterior, or ventral, and then anterior movement of these structures? What causes the bulges to occur around the vasculoneural bundle? Granted, we keep that in mind, but something has to occur to form these protruding structures. Well, actually, it's the invasion of neural crest cells, and these neural crest cells differentiate into a specialized mesodermal layer called mesenchyme. And so we add to this list of derivatives of the neural crest cells. Recall that it basically produced all of the peripheral nervous system, except the axons that come from the central nervous system, like the alpha motor axons from the spinal cord. But everything else of the peripheral nervous system develops from neural crest cells, the adrenal medulla, the melanin-producing cells in the epidermis. So we went through that long list. Now we're adding to it some very specialized structures within the visceral, branchial, or pharyngeal arches, whichever term you choose to use. So there are 4 well-defined pairs, as we've been pointing out, and then there are these rudimentary 5th and 6th. So there's actually 6 arches that develop. The lowest number is the most cephalad, and the or superior, and the most inferior, or caudad, are the highest numbers. So 5 and 6 are rudimentary deep down in the neck region. They are separated by grooves, and as I said, they're numbered craniocaudally, and each arch is going to contain a variety of structures, and we'll hold on what that is until after we've gone through another series of views. It's important that we attempt, and I make a big point of that, we attempt to visualize everything that's happening here and create some type of a 3-dimensional appreciation for this. And we need always to come back and picture our fingers pushing from the lateral sides of the back of our head, basically sides of our neck, pushing out and coming around in front to form things. So we're going to have things on the surface and things inside and things in between. Think of webs between our digits as they push out and come around. And this can help us to envision this 3-dimensional effect. So days 23 and 24, we are looking from a dorsal view of the cranial part of the embryo. Remind ourselves that the neural tube has not completed its closure at the most rostral portion yet, so there is an opening here. Another term for opening is pore, and the rostral or anterior neural pore is still open. We can see the mandibular, or the first arch, beginning to form as a bulge in this area, so we can picture neural crest cells migrating into this region and generating this bulge. So we were looking a day ago, but also from the dorsal back view here, we were able to envision this mandibular arch, and we could see the anterior neural pore. It is going from being somewhat flared to coming closer together. So just in a matter of a day, the anterior neural pore is getting closer and closer to closing off. So this whole head development goes from just an open, we know it's the neural plate is flat, and we get the folds, and ultimately it comes to close as a tube and close off anteriorly as the tube, and that basically represents the top of our head. So this is basically the top of our head where we put a hat. Everything else has to happen to form the forehead and the face and the neck region. So we see that early set of events producing the first and the second arch. We recall that within here, the vasculature, the vasculoneural bundle is going to be developing. With the invasion of the neural crest cells, we, in our mind, should be automatically envisioning the extension of the peripheral process of a sensory ganglion cell, the myelin-forming cells coming from neural crest cells. This is all part of the peripheral nervous system, and any other types of cells that are going to bundle this together into a nerve. Also invading into that are any motor axons coming from the neural cells within the neural tube that is now closing off. So all of this is occurring to form the peripheral nervous system from the neural crest cell component or contribution. So it's very easy for us to envision the neural crest cells moving into there, also differentiating or following a lineage of differentiation into mesenchymal cells, both in the first arch and the second arch, in 24 days, we will see a horizontal section at this level in another panel. At 26 days in panel C, we see that the third arch becomes prominent, and the first and the second have extended. Again, we're picturing those fingers coming out. And by day 28, the fourth arch is quite well developed. Immediately in our mind, we should envision the vasculature and the neural structures within here. So we know somewhere in there there's a blood vessel, very likely running from ventral to dorsal in its orientation to give this type of a columnar appearance to these arches, or an arch appearance to the arches. We note that there's a space between each of them, the space between our digits. But if we could separate these, we'd see that the digits would be webbed. And so there is a structure, continuous structure between arch 1, arch 2, and arch 3, and so forth. So we will also take a look at a horizontal section of day 28 through this region. So ultimately, we're going to see horizontal section of day 24 and day 28. For that, however, we'll take a quick look at this view of the fourth week, and we're getting to see a little more of the anterior surface. Still, it's a lateral view, but we're seeing a bit more of the anterior aspect, and we can see that these arches are beginning to come together. So obviously, the rostral neural pore has completely closed by this stage, and that closure is progressing from dorsal all the way down ventral to create the forehead, and now beginning to contribute to form the face, which basically involves the eyes, the zygomatic bone, with the maxillary process in this area, and the mandible has to come around and fuse and close in the front as well. So the stomadeum is still in this general area here. We know that the oral cavity opens somewhere between the maxillary process and the mandibular process, so the stomadeum would be right here, this primordial opening to the oral cavity. The maxillary, so it would be up here. Sorry about that. I was shoved down too far. It didn't look like that would be where it would be. So this is the mandibular, the maxillary process and the mandibular. The stomadeum is up here. I apologize for that misorientation. And then down here is where the hyoid bones are coming together. So this is going to be down in this region below the mandible. The offset positioning of these letters throws you off. Don't let that throw you off on the exam. And don't let my statements throw you off. So maxillary process up here just under the eye. Mandibular process just as we proceed caudally from that. So the space between the maxillary process and the mandibular process is the stomadeum. And we get the fusion of the mandibular and hyoid processes progressing on the ventral surface here to close off the mandible and the neck region, the upper neck region. And the third arch is present down here, and we still can see the fourth arch and really don't see the fifth and the sixth arch. So now let's rotate right around and take an anterior view looking at 23, 26, and 28 days of development. So now we're seeing the stomadeum. We're looking down, up into what was basically the prochordal plate that has become the oropharyngeal membrane. Now we need to clarify our statement. This prochordal plate becomes a membrane identifying the opening, the primordial opening into the oral cavity, but it actually is located at the junction of the oral cavity and the pharynx. So we'll follow that as we go along. So the oral cavity is actually going to form in front of or anterior to this oropharyngeal membrane. So as structures, so that membrane came into place before our fingertips come in front of it to form the nasal and the oral cavity and the upper throat region. So keep that in mind. So there is a membrane that occludes the opening into the foregut. So the oral cavity is going to form here in front of it. So this basic space here that we're looking at in front of this blue membrane is the stomodeum, primordial opening. It's irregular in shape and rather difficult to envision, but this general space, if you were standing in this space looking at that membrane with it right in front of your eyes, you'd be standing in the stomodeum, and the oropharyngeal membrane would be right at your nose. Now we stand on the heart prominence on day 28, and we see that the oropharyngeal membrane is beginning to dissolve. It's basically 2 cell layers thick with a little bit of extracellular matrix, mesoderm or mesenchyme in between them, if anything at all. And so it's not a tremendous event that it can rupture and simply deteriorate. So it's not vascularized. So this is a rather straightforward thing to picture. I'm sure the molecular signaling and all the other events are really rather sophisticated, but it's not like we're envisioning the disappearance of a big, thick structure that has many components in it. Just a couple cell layers thick, so easy to envision it degenerating and rupturing. So that we now have a continuity of the stomodeum and the primordial pharynx just caudal to it. So we see that the maxillary prominence becomes more prominent, and the mandibular prominence has already fused by 26 days. So in 3 days, mandibular prominence finishes its route coming around to the front, meets, and fuses together. And the maxillary process begins to move in. We've got complete rostropore neural closure. The forehead would be in this area. The otic the nasal placode is starting to develop in this area, and it's well developed by day 28. By day 28, we've got fusion of the first arch, the second arch, and the third arch. They're fused in the anterior midline, so that's day 28. A little more advanced than what we see here in this week 4. You see that the mandibular arch is ready to fuse here in this early 4th week, and the hyoid arch, the second, is just about to fuse. The third is coming around. In this stage of 28, the end of the 4th week, they are fused together. The stomodeum is still this general space between the fused maxillary arches and the mandibular arch. And we see the opening at the back of the stomodeum where the oropharyngeal membrane has ruptured. So now as we stand here on the heart bulge, we could place our hands right on the mandible, basically, and look into the oral cavity and look all the way back through into the pharynx. So it'd be like opening your mouth in the mirror and looking in past the lips. These would be the lips here at the surface. And the oral cavity would be the space that you'd step into. You'd be looking through that hole in the back into the opening, through the opening into the pharynx. There is now a cavity that is created by the maxillary arch coming and fusing above where the mandibular arch fused. And so you'd go between your fingers and you're in a space in there. So this mid-sagittal section that'll take us, that we'll see in panel J, will let us look into the sides of that. So we now step into the developing oral cavity and take a look at the lateral wall when we get to panel J. So first, let's look at day 29, what is occurring here. The eye is developing here, so we've been following that. There now is a development of a frontonasal process that has pushed in together. There's a membranous capsule over the cerebral hemisphere, so the anterior neural pore closed here. And now there's a capsule in front of that cerebral hemisphere. When the anterior neural pore closes, that's obviously going to be part of the formation of the cerebral hemispheres, the brain inside our head, filling our forehead or behind it. Then the frontonasal process is coming in, and we see a globular process here coming to join with the maxillary process. So it isn't a simple fusion of the maxillary process to come around and form the upper jaw. It is coming in to become an integrated part with the zygomaticus bone and meet with portions of the temporal bone and frontal and all the other, and the nasal bones and everything, all the bones in this facial area of the skull. So it's a tremendously complex interplay between the surface ectoderm, ultimately fusing together, opening up, and allowing the mesodermal, or the mesenchyme within there to interact so it joins the bones, it develops the bones, joins the bones at their sutures, and all the musculature and everything else is going to develop. The mucosal lining on the inside versus the type of epithelium we have on the outside, we know it's somewhat different. So all of this is going to develop from the cells in this area. So we now can see the stomodeum, this opening. So if we stood here on the heart bulge and put our hands on the mandible, as the mandibular arch is fused here, and we looked in, stuck our head in through the first opening below the nose here, basically, would be that opening would be the stomodeum. But we now can look way past, deep down in, and see the pharynx, the front part of the foregut, will be open right into that area. So we'll proceed with day 31 with this anterior view. We now have seen that there's a lateral nasal process, the olfactory pit, so we're starting to form the nose, the nares, the opening to the nose. The previous one, we saw the frontonasal process, and so it has moved into this location, contributing the medial nasal process. So we're coming together there. We see the stomodeum with the mandibular arch fused, so we still would look in there. And the maxillary process is coming closer to this lateral nasal process and the globular process to fuse and close off all of this area that forms our nose, the bridge of our nose, the external opening, the nares of our wings, if you will, of the nose. So it's a very complex organization of everything in this area. Obviously, the eye is still developing up in this area onto the sides. So that is a struggle for us to try to view it from the surface, looking from the sides, looking from the back, looking from the front. We are using the simple image of three of our digits coming forward to meet together. That works kind of okay for the arches, but not so much for the maxillary process and the nasal processes and the globular processes. That's a little more complicated, but we do have the lecture 17 that focuses basically on the development of the face. Let's back off now and just look at the four arches and what becomes of them and what is contained within them. This is a continuation of this figure from the textbook that we've been using. There's panel H here, panel I, and panel J. So we have the two coronal sections. I think it was day 23 and 28 were the two that we were going to look at. Most importantly, we start first with this structure here, just the beginning of the closing of the neural groove, close, not quite at the rostral neural pore, so we're still behind it, still caudal to it. This isn't the rostral neural pore, but we see where the neural tube is beginning to form or continue its formation as the groove is closing here rostrally. So this is basically somewhere in the upper neck region that we would be looking at. And we know that the neural crest cells are going to be originating from this area in here and moving on out to form the peripheral nervous system to guide the central nervous system, alpha motor axon, and contribute everything to this developing structure. And this has occurred already a little bit farther back for the formation of the first arch, the mandibular prominence. And we see within the mandibular prominence the first aortic arch artery. There's a vein, and then this is going to be some developing connective tissue. And we already stated that this forms from the neurocrest infiltration or invasion. So we know that there is there is neural bundle in here as well. And we automatically in our mind, when we think of neurovascular bundle, throw in the lymphatics. So I always like to throw that in there so we don't just think artery and vein developing. The lymphatic vasculature is developing as well. So here is the oropharyngeal membrane. So this basic space out here between this prominence and this prominence would be the stomadeum. That irregular virtual space is the primordial opening to the oral cavity. As we would stand on the heart bulge and look in, we would see this membrane, the oropharyngeal membrane, that is closing off this portion of the foregut, the rostralmost portion of the foregut, the pharynx. We see that there is a bulge of the pharynx, or this rostral foregut, laterally to form these pouches. So there is a pouch with each arch. So we're looking into the first pharyngeal pouch. On the external surface, a surface feature is the groove. And between the groove and the pouch is the membrane. So this is the list of structures we talked about. There's going to be an arch with its contents, and there will be a groove and a pouch. So a groove externally, a pouch internally, and a membrane separating the two. So now we look at this horizontal view of the later stage, and we can see it's much more developed. So we're looking basically at a section, if you look at J, the section going through this plane here, so it's not a perfect horizontal. It is from an earlier stage of the embryo, but still it gives us a nice plane of section so that we see the arches cut in cross section. So here's the first, second, third, and fourth. And we can see on the outside, just at the cut edge, the groove in between the first and the second, groove in between the second and third, groove in between the third and fourth. On the inside, we see the pouch. So the pouch is an out-pocketing on the inside. The groove is an indentation on the outside. The pouch is an out-pocketing on the inside, and the groove is the in-pocketing on the outside. Okay. Then the thin portion where the surface ectoderm, well, let's just say the epithelium on the outside and on the inside approximate each other where it thins out. There's less mesenchyme within it, where the groove and the pouch approach each other. This is called the membrane. So there's a membrane with the first, second, third, and then, of course, still here with the fourth, because there is a remnant of fifth and sixth. So let's look a little bit closer at the key down below here. The blue coloration is showing ectodermal contributions. So one of our objectives, we said, was to, other than this general three-dimensional view, was to get a feel for what was the contribution of each germ cell layer. So we see the ectoderm is contributing, if we could see it, on the outside of every pouch, and you can basically see it, the outer edge of each arch. I said pouch before, I meant arch. The outer edge of each arch and groove is blue here, so the surface ectoderm is contributing to the surface features. the epithelium on the external surface of all of these. Then when we look on the inside of the first arch, we see that it is blue, so it is surface ectoderm that is contributing to that. The second pouch is present here. The second arch on the internal surface, all the way through the fourth. That's all we're going to follow. And that is colored yellow, so that's endoderm, so that's the foregut. So obviously the buccopharyngeal membrane, the oropharyngeal membrane is going to be attaching right along the margin of the first and the second arches on the inside. So this means that when the mandibular arch comes around, it is covered by surface ectoderm. It's the first arch. It's all surface ectoderm. So this means that the entire mucosal membrane lining our oral cavity originates from ectoderm. And it's the same type of epithelium, stratified squamous. Of course, it's non-keratinizing unless your oral cavity dries out, or if you've ever gotten like a thick kind of a callus on your tongue or the inside of your cheek, you know that you can basically get a callus there. But the salivary glands contribute to keep it moist, so it's not quite the same as the outside, the lips and the skin. But basically, it is the same type of epithelium with just minor modifications, stratified squamous epithelium. And then the endoderm contributes all of the remaining pharyngeal mucosa, the epithelium and the glandular epithelium as well. And of course, the mesoderm contributes all of the connective tissue and the vasculature for that as well. All the neural components are ectoderm except for motor neurons from the neural tube. So we see within each arch its contents. Then we see the lateral view here, and we can see there is a slit opening into each pouch. So the stomodeum or mouth opening is here, the former site of the oropharyngeal membrane. They have, I think, misrepresented this maxillary prominence and the mandibular prominence. These should be blue to be consistent with that. I believe that is an error in the illustration. So the oropharyngeal membrane would be here. Everything caudal to that is going to be endodermal origin. So then, define the term pharyngeal arches. So these are surface elevations. So the arches are the surface elevations, both external and internal surface. We saw that in the previous slide very nicely. At the future head and neck region, they consist of bars of mesenchymal tissue covered by epithelium, either ectodermal or endodermal origin, cells, and they're separated by each other by the pharyngeal clefts or grooves on the outside, and of course the pouches on the inside. So what are the swellings? List the swellings or the prominences that surround the stomodeum in a 4 to 5 week old embryo. So there's that frontonasal prominence that we talked about, the maxillary swelling is coming around, and the mandibular swelling are contributing to the stomodeum, this irregularly shaped, somewhat difficult to visualize primordial opening to the oral cavity. So there's a single unpaired frontonasal prominence. There are two or paired maxillary swellings, and the same for the mandibular swelling. So now we can wind this up by talking about the contents of the arches. There's the vascular element called an aortic arch. There's a cartilage element contributing to the skeleton, a muscular element. Remember, these are all mesodermal. Mesodermal comes mesenchymal, or mesenchyme comes from neural crest cells. So these are all of this type of origin. Somewhat of a mixture, but predominantly in this area, we are recalling that it is mesenchyme from neural crest cells. So it's a very specialized type of lineage or development and differentiation into these structures that we typically immediately assign just to mesodermal origin. It's not shocking because epiblasts give off mesenchyme cells, and then the ones that stay behind are the ectodermal cells. So it's not such a horrendous thing to try to envision. This is just a later stage where cells of ectodermal or epiblast origin go through a lineage of differentiation to become more mesodermal or mesenchymal type of cells and differentiate into vascular connective tissue of skeleton, muscular, and of course we do have the nerve contribution, the neural crest cell lineage that we are most familiar with. Sensory and all the accessory cells that go with it, myelin and so forth. And the motor axon actually comes from the CNS, as we know. So the first arch is the mandibular arch. We're referring to table 10-10.1. So the maxillary prominence, we'll just throw that in there, as within it a nerve, cranial nerve 5, and the malleus and incus bones are going to form from this. The mandibular process, the true first arch, is going to have the muscles of mastication develop from it. There's a list of neurovascular structures. Those were just a couple of examples we tossed out before we get into the comprehensive list. So then, very quickly, the review, the nasal placode, the lens placode. So we know that the nasal placode is going to have to rotate, again, more ventrally and caudally, and then move back dorsally to fall in under the, or inferior to the nose. So there's a little more folding or progression of this that has to occur to bring it down into place. But here are the four branchial arches, surface view. We cut away the surface ectoderm, and we can see the arches and the endodermal pouches forming from those. This is the oropharyngeal membrane. Note the covering, the surface ectoderm on the mandibular arch. So each arch has a vascular or an aortic, the arterial component called the aortic arches. You know that in the end, the adult has a single, even the neonate has a single aortic arch, but there are multiple ones at these stages when we have the pharyngeal arches. So there's 1, 2, 3, and 4 that we will deal with. We also, because we're seeing the endodermal lining, we see the first pouch between the mandibular and the hyoid arches. We see a single ventral diverticulum in the second arch, and that is going to become the thyroid gland eventually. We see the pouches in the third and the pouches for the fourth. So all of these structures are evident here. We now see the esophagus and the lung buds. So all of this was that primordial foregut that was pulled up in when we had the head fold with the placode and the heart coming around, the prochordal plate and the heart coming caudal, ventral, and then finally dorsally to fall into place. The yolk sac that was pulled up into there becomes this foregut and continues to develop into these ornate-looking structures that we see here. We can see very easily how these could develop into the where the respiratory apparatus would just simply have been shifted up to here with all the vasculature for these to become the gills in the corresponding species. The last slide that we'll look at today is just the contents of these. We'll introduce the term for the cartilage. The cartilage is in the first and second arches. The first arch has Meckel's cartilage. The second arch has Reichard's cartilage. And so those are shown in the illustration here, representing the vascular bundle and the neural bundle, vascular, they're just showing the artery. We always put the vein and the lymphatics in there with it. And then this darker red is the muscle component. So there is the mandibular arch with the first membrane, hyoid arch with the second membrane. We see the pouches for each of these. And the third arch with the membrane and the pouch. And then the fourth arch just showing the mesodermal core in this area here. So we'll follow through with this on Wednesday and complete the Lecture 16 and blister through Lecture 17 and get on to Lecture 18. I appreciate your time and attention. I'll remain here for a few moments if there are any questions.